Soroti Regional Referral Hospital, with a 297-bed capacity, has been in the news for all the right reasons. 2 successful specialized surgeries in less than a year is not an everyday thing. This success lies on the shoulders of a team of health workers that has been working together for over 2 decades. Dr. Joseph Epodoi, a senior consultant surgeon at the hospital, has been here since 2001. He led the team comprising more than 15 colleagues that separated conjoined twins on the 26th of March this year. Dr. Epodoi says they value teamwork in their professional decisions.
If you have a team you are working with, people you are working with, people you can discuss with at the same level, you'll find that you operate together, you find that you even learn better.
He says that for this particular case, they were working against time.
We saw the situation really very desperate. And something could be done. This was now on the 4th day, and one of the children, the dead, had actually started decomposing. There was no room for bureaucracy. There was no room for academics or chatting.
For first-timers dealing with a task of this magnitude, the procedure that lasted close to 4 hours is a huge step in their medical career.
It was really a terrifying moment because this was the first ever in life to get exposed to this situation, to have such twins get onto our table and to be separated.
It's actually exciting to see that I would say God used us to give life to this child so that the life can be continued. So it's quite exciting, and me being a female surgeon, it's even, I think, more exciting.
During the processes, also we're liaising up with the chief surgeon, and we're asking him, sir, how are you moving on? And he was like, okay, on his side, he's busy doing well. So we got that motivation that every team is doing well.
Senior consultant pediatrician Dr. Florence Alaro says this operation awakens public confidence about up-country hospitals.
Many times people fear coming up-country. They feel that when you're up-country, first of all, you cannot do much because of the limited resources that are available, the machines that may not be available, so you may not be able to do such operations.
For this reason, Dr. Epodoi says such specialized services should be decentralized.
Not that malaria cases, diarrhea will not be treated. Yes, all those cases will be there, but you have a unit there which does high-end, super specialized services.
The medics say the baby's health is improving.
The time when the operation was done, the baby had an infection from the dead twin. And so our main task was to make sure that we try to control that infection. And I must say that we have actually been successful. In that from the time of the operation when the baby had very high fever, now I think for about 3-4 days, there's been no fever. Okay, we had to change to other very strong antibiotics, which we don't have in the hospital here, but we've made it a point that is bought and brought for the treatment of that baby.
The Regional Referral Hospital conducts up to 50 surgeries a month, and these are all from the Teso region. Walter Mwesije, NTV.